In September, officials from my ministry sat down with the City of Vancouver to discuss how we can respond to these challenges. Following these discussions, I asked my Deputy Minister in Vancouver Coastal Health to develop an action plan. And the action plan that we have for you today is designed to respond to the concerns that we've heard here in Vancouver, but also elsewhere in the province, from Victoria, from Surrey, from Prince George, from Kelowna. And so it's a challenge that, of course, is not just unique to British Columbia. In fact, if you look at the Wall Street Journal from September, this is an issue that faces communities throughout North America. But of course, we've shown before that we can be a leader in the development of tangible solutions, and so we want to, again, lead and take actions that are designed to reduce barriers and gaps in our system and support evidence-based solutions. It does include immediate actions like new urgent care capacity and community outreach, as well as longer-term strategies and solutions. One of the immediate actions is to improve capacity at St. Paul's Hospital to better respond to urgent and emergency patient needs. So as part of this plan, Vancouver Coastal will develop a 9 to 12 bed unit adjacent to St. Paul's Emergency Department. This unit will provide psychiatric assessment and stabilization and support more efficient transfers from responders to health professionals. That way we can have police officers out on the street rather than being tied up in the hospital. Vancouver Coastal will also create a new type of outreach team, an assertive outreach team to serve patients in the downtown east side. This team will bring rapid response services to patients who are at very high risk. Vancouver Coastal will also establish 2 more assertive community treatment or ACT teams, much like the one that I visited with last week. This will bring the number of ACT teams within Vancouver Coastal Health to a total of 5. And I'd like to recognize our representatives from Vancouver Coastal Health who were instrumental in supporting the development of these actions, including Dr. Jeff Coleman, who is here with us today. These immediate actions I've just described will be implemented by Vancouver Coastal over the next 120 days. On a broader scale, the Ministry of Health is providing $5 million to support Vancouver Coastal and the Provincial Health Services Authority to take swift action in this area this fiscal year.
So it's essential that we see action in the coming 120 days and the months that follow to stabilize these people in particular. I would like to thank the Minister for his commitment on this issue and working diligently on these next steps. Making these kind of important strategic investments in tough fiscal times is notable, and I'd like to acknowledge the Premier as well for her support, as she has repeatedly expressed to me a commitment on this issue. We've talked about it every time that we've met, and I'm heartened to see this leadership from the Premier and Minister of Health to take action.